I'll start by taking a past and present history, and then I would inspect for any swelling, discoloration, deformity, as well as the carrying angle for any excessive or gun stock deformities. Then I'll begin with bony palpations. I'll palpate the bicipital groove of the humerus, as well as the shaft of the humerus. Let's see. And then the what's it that? Shoot, what was next? Oh, the lateral epicondyle, the medial epicondyle, and then the olecranon fossa, which is going to be here, but that's kind of hard to palpate. Then the olecranon process. Let me turn a little bit actually. Just here. And then the shaft of the radius, as well as the distal head and the proximal head. And then turn a little more. The shaft of the ulna, which is this lateral on the medial side, and the distal and proximal head. Then I'll move on to, is that it? Yeah, okay. Then I would move on to soft tissue palpations, starting with the biceps brachii, the triceps brachii, which are back here, and the wrist flexors. You have for wrist flexors, you have the pronator teres, the palmaris longus, and the flexor carpi radialis, which is here, and the flexor carpi ulnaris. I think that's it. Yep. And then for wrist extensors, you have the extensor carpi radialis, which is going to be here, so to the forearm, and then extensor carpi ulnaris, which is here, and then the extensor digitorum longus, which is this guy. Then I'll palpate the brachial radialis, so make a fist, and then it's this guy. And then the brachialis, which is brachialis. Then the ulnar nerve, which is gonna be ulnar. Is that this guy? The ulnar nerve, and then the medial and lateral collateral ligaments, as well as the annular ligament, which is kind of here. All right, next we'll do range of motion tests. I would test it actively and passively. In this case, I'll have them do it actively. So we'll do flexion at 155 degrees, extension at 0 degrees. We'll do supination at 90 degrees, and then pronation at 90 degrees. And then for muscle strength test, with resisted range of motion, we'll start with flexion. All right, ready? Go. Go, 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 go. And that's for the biceps brachii, the brachialis, and the brachial radialis. Then we have extension. Go ahead. Push, 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 push. And that's for the triceps brachii and the triceps brachii and the anconeus. Then we have forearm supination. So start here. Ready? Go, 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 go. And that's for the supinator as well as the biceps brachii. And then we'll have pronation. All right, ready? Go, 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 go. All right, nice. And Form pronations for the pronator teres and the pronator quadratus. Next is going to be motor function. We'll start with neurological. We'll start with motor function. So C5 is going to be deltoid. So do this. C5. C6 is going to be wrist extensor group. So this. C7 is going to be triceps. So, and then wrist flexor and finger extensors. See that? Alright. Let's go this way. Pull it up. And then C8 is going to be finger flexors. And then T1 is going to be finger abduction and adduction. Next is going to be sensory. For C5, it's going to be the central medial forearm. C6 is going to be the thumb. C7 is going to be the middle finger. C8 is going to be the pinky or the little finger. And then T1 is the central medial forearm. Then it's going to be, we're going to move on to reflexes. You have the biceps tendon reflex, triceps tendon reflex, and the brachioradialis, which is this guy right here. Tendon reflex, then it's a blood flow test. I will do a radial pulse. Alright, now I'll record that for 15 seconds. Alright, and then do 17 times 4. Use your phone real quick. Calculator. Or 17 times 4 is 7. That's 20.
68.
68 beats per minute, strong and regular. Then a recapitularization test, or the Allen's nail bed test. You can pinch here. Color should come back within 2 seconds. If they have nail polish or you can't see their nail, you can do this and color should still come back within 2 seconds. And then I'd compare bilaterally.